Seeing a doctor can be scary for some people, and even asking questions when you may not understand what they're telling you can be even scarier. Joining us in studio tonight to tell us more about practical ways to talk with your doctor is Dr. Kim Stuck with WVU Medicine Camden Clark. Dr. Stuck, thank you so much for joining us this evening.
Thank you for having me.
Of course. So the first thing that I'd like to ask you is, what are the most common mistakes patients make when communicating with their doctor, and how can we avoid those mistakes?
I think one thing that's very important to remember is that communication is actually a two-way street. I think the mistake is that you're going to the doctor for the doctor to tell you something.
Right.
Or your healthcare provider to share that with you. It is so important for us to get the information from the patient as well so that we can make a proper diagnosis and evaluation.
Definitely that open communication where you guys are both being honest, transparent about what's going on.
Absolutely.
So how should a patient maybe prepare before an appointment to make the most of their limited time in the exam room?
I love this question because I think preparation can go so far.
Right, it's a key step in a lot of parts of life.
Absolutely. So I think the idea is to first sit down prior to the appointment, maybe a couple days before, and what are the most important things you want to share with your doctor? What are the things that you're concerned about? What are the things that you are happy you've accomplished since the last visit?
Right.
What are the updates that you feel you need to give them? And actually write them down. Don't just think you're going to remember them. Write them down, because when you get in the exam room, you know there's a certain amount of time and you're like, oh, I can't remember.
And then so getting nervous, anxious too.
Yes, yes.
Definitely. And so what should someone do if they feel like their doctor isn't listening to them, or maybe, dismissing their concerns?
Well, I think that there's always a little bit of a gap between a patient and the healthcare provider as far as the knowledge base and kind of going to that next step in their mind. It may not be that your provider's dismissing things. It may be that they're picking up something else in the conversation that was actually more important to them.
Right.
That something could be more dangerous for your healthcare. So if there's something you're wondering about, just ask them. Say, could we go back and revisit that topic, because it's important to me.
Definitely. I think that's some great advice. Now, like you just mentioned, is that the best way maybe for patients to make sure they fully understand a diagnosis or treatment plan before they leave the office, or there may be other alternatives that you could suggest?
I think that is a very good plan. I think it's also good if it's going to be a complicated visit, maybe a lot of test results or something, have somebody else with you.
Right.
Have an advocate with you. I always say 4 ears are better than 2 ears. And so you may both hear different things and understand a bigger picture when you get home.
Definitely. And so what advice do you have for patients who feel intimidated or nervous about speaking up during their appointment?
Oh, I understand that, and healthcare can be intimidating.
Definitely.
And health providers don't try to be intimidating, but I understand that environment. We want to help you be your best self. And anything we can do to improve that communication, we want to be part of. So take a deep breath, speak up for yourself, advocate for yourself, and make sure that you feel listened to before you leave.
Definitely. And are there any more advice or tips that maybe you could share with us before I let you go tonight about practical ways speaking to your doctor when you're in the exam room?
I would say conversations are so important. When you go into a conversation with a chip on your shoulder, you might not hear everything, or assuming you've already learned something from maybe an app on your phone or something. It's good to ask questions.
Definitely.
But not assume that the information you're bringing from those devices are 100% accurate.
Okay, well, perfect, Dr. Stuck. Thank you so much for sitting down with us and sharing a wealth of information about this topic. It's super important to have those conversations and make sure that your voice is heard as well as you're the patient, going to the doctor, trying to get yourself feeling better.
Absolutely. Thank you for having me.
Of course, it was a pleasure.